right. Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heining, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Best test to diagnose impingement syndrome. Did I say that right? Impingement syndrome.
Yep.
And rotator cuff pain. Now, this is obviously we're talking about the shoulder, Brad.
Yes, right there.
So we want to know what's going on because in order to treat anything, you need to know specifically what you're treating.
It helps a lot.
Right.
And so we're going to show you how to do it. We're going to show you how therapists and doctors do it. And Bob, but there is just a few hundred people out there waiting.
Just a couple hundred this morning. We're going to
they were
provide you
slow.
with, if you subscribe to us, by the way, if you're new to our channel, we're going to provide you with videos on how to stay healthy, fit, pain-free, and we upload every day. Also, please go over to Facebook and like us. Because very soon, coming very soon, I know we keep promising this, but we're going to give away some stuff again. So, if nothing else, we're going to be very, very accommodating to you.
One of our fans is out there.
Yeah.
Okay. All right. So we need to look at the shoulder first from this point of view.
Sure.
Okay. Gumby, get out of the way. Okay. So here we have.
Let's go closer.
Yeah.
Brad.
Yeah. That's
Lonnie,
a good
tell
idea.
us how close you were going to allow us. I know you have a restraining order against us.
Okay, so here we got the shoulder, they got the humeral head, and this red tendon represents the supraspinatus tendon, which is by far the most commonly impinged.
Involved muscle, yeah.
Yep. And so the muscle part is actually up here. The tendon goes underneath part of the acromion, or part of the scapula, the shoulder blade, and right here. Now you can see if this goes up, let me see if you get the right angle there, that there's going to be pinch, and that's what I'm talking about, impingement or pinch right there. And if that pinches too much in a row, it frays and eventually tears the tendon. So what needs to happen is we have to have a gap in there, okay? So that's what we're looking for. I'm going to show you two tests specifically to figure that out. Now, the other thing that could be wrong is shoulder pain.
Well, just one thing I was going to point out, Brad. On a normal, healthy shoulder, it doesn't do that. It doesn't pinch.
Right,
yeah. In your shoulder, if this bone is moved forward, for whatever reason, well, and we're going to go over this actually in another video.
Sure.
It's going to cause pinching.
Right,
Okay.
right. The mechanics of the shoulder is actually pretty complicated.
Yes, it is.
You know, when I was in school, you said it's probably the most complicated joint in the body.
I agree.
Well, you think about it,
concur.
it does this, it does this, it does this.
Yeah, it's got mobility and strength, which is always puts it at risk for injury then.
All right, so then the rotator cuff.
Cuff.
Okay.
We've heard it called cuff.
So the rotator cuff is actually four muscles.
Show how that goes
so
on here.
yeah, this would be right here, and here's
That's
the
the
humerus.
shoulder blade.
Right. So right up here, supraspinatus, that's one of them, very commonly involved. Because then the infraspinatus, there's that bone part right here, which is here, the infraspinatus, and then there's a teres minor, which is here, a little bit smaller muscle, and then the subscapularis.
It's inside.
Yeah, that's like back in here.
Yeah.
And that's another one. We're going to show you the tests on how to differentiate.
So there's four rotator cuff muscles.
Right.
And he just went over all four of them.
So technically, these are differential diagnosis techniques.
Yeah, he's trying to pull out which specific muscle it is.
Right.
So,
All right, Bob.
if you have any of these, you're having problem with your rotator cuff, basically.
I do want to say if you got shoulder pain and you're not, this is all you can do, there's a good chance you got
a tear.
Yeah, it's not an impingement problem. It's something with the rotator cuff, and you may just want to go in.
Unless you have really severe arthritis, too.
Well,
It could
that's
cause
true.
that too, but generally, you're right. If you can't lift, then you're thinking a tear.
Right.
That's
Especially
a rule of thumb.
when you see the,
Yeah.
you know, when you're a therapist, you see that.
Yeah, when they come in, you know right away almost.
All right.
All right, first one, Brad.
Okay, the NEAR test.
N-E-E-R.
Yeah, well, why don't you have a seat right
Sure,
there, Bob?
named after Dr. Neer. I'm
Dr.
sure.
NEAR. We're going to get one of these named after us someday,
That's
Bob.
right.
All right. Okay, so with the NEAR test, we're going to go in abduction out to the side and up like this all the way to end range. And it's a positive test. Typically, it either hurts up at the end range. The person says, oh, that hurts. It usually bites pretty good. Sometimes,
It's in the middle, yeah.
yeah, you get a painful arc, we call it, range right there.
It
And that would
depends
be
where it is on the tendon is
Yep.
basically where
Right.
the lesion is.
Okay.
So,
So what you may want to do is have a piece of paper and write these down. The NEAR test, either positive. Sometimes they're like, I think it's positive because it's kind of painful but not bad. Then we call it semi-positive. And then another category for no problem. All right, Hawkins Kennedy. Now, there must have been 2 doctors on this
That's
one,
right.
Bob.
So that's why we
Dr.
could have
Hawk.
Heineck Schrupp.
There you go.
Yeah.
Yeah, we're going to get that going. Okay, now this one we want to do in the scaption plane, which there's straight out in front of you, which is flexion, abduction is straight out to the side, and then the scapular plane is kind of in between there,
yeah.
right? Okay, so on this one, at 90 degrees in the scapular plane, bend the elbow 90 degrees, hold the elbow right here, and that stays stationary, and we're going to internally rotate the humerus. Bob's making faces.
No, it's no pain. It's just you feel like you're going to
even
dislocate my arm.
Even a healthy shoulder does feel a little different. So
Yeah.
the nice thing with all these tests is typically one shoulder's good, the other one's sore. Just go over to the other arm and see what the difference is, you know.
Yeah, it's the same feeling.
Right.
There's
okay.
no pain.
Right, so that's negative. All right, so those are the 2 tests for the impingement. How to figure out if that tendon is getting
Impingement's very, very common.
Right.
A lot of shoulders with it.
Okay, now the rotator cuff muscles, Bob. What should we start with?
Supraspinatus.
We might as
the
well.
one
It's
that's
the
the most common one.
Right.
Up here again, remember?
Right, up here. All right, let's turn this way a little bit, Bob.
Sure.
Now this one is a very common one. It's called either the Job test or the empty can.
Okay.
Now, on this one, what we're going to do is go in that scapular plane again, kind of out at a 45. I want you to thumb down towards the floor. There you go. That's why it's the empty can, because you're...
Sure, you just turn the can.
There you go.
Yeah.
And then we're going to come up at 90 degrees. Okay, now I got these from an article that had some nice studies in it, and they reviewed a lot of different studies. And these are the tests that they thought the numbers actually showed the best results as far as coming
Most
up.
reliability.
Exactly.
Okay.
And then you're going to push down here. If that creates pain, or if you just can't hold it and there's pain associated with it, positive test right there.
Yeah.
If they can hold it there and you can push and there's no problem.
Remember, positive is negative. I mean, positive means something's wrong.
Right, right. Yeah, that's a little confusing.
It is.
I'm glad you brought that up. Okay, now the next one we want to go to the,
The muscle that's right below that one.
right, the infraspinatus. Now, you're going to take, let's turn sideways once,
Sure.
Bob. I'm glad you're on that stool. We're going to take the shoulder, come up about 20 degrees, okay, which is right there. You're going to bend the elbow to here. Now, I'm going to stabilize. I wish I had my stool here, Bob. Why, Bob?
There's that stool if you
Yeah,
want to take it.
that'll work, but I wanted one with wheels. You know how us therapists are. I'm going to just gently come out, externally rotate as far as it can go. Okay, and once it's there, I'm going to let go, and the instructions are, Bob, I want you to keep it right there. Don't let it move once I let go. And if you can hold it there, then it's a sign that you have a healthy infraspinatus muscle.
Sure.
Okay,
If you can
if
hold
I
it
go like
there.
here and it comes back, and it doesn't even have to come back all the way. If I let go and it comes back a few inches and you cannot maintain that.
I can feel it. I can feel it actually.
Right.
It's being maximally externally rotated right now.
So you know, you're doing a pretty good isolation of that
Yeah,
muscle.
you are actually. I can
Sure.
really feel it in there.
And the other thing is, you really cannot isolate just one muscle, truly. I mean, this is
Right.
the best we can do because the way the muscle, the
Is
body
there a name
works.
for that one, by the way?
Yeah, there is. It's called the external rotation leg test.
Oh, okay. External rotation leg.
Yeah, it's kind of a mouthful.
Just kind of what it is. It should have been named Heineck Schrupp. I mean,
There you go. Maybe we could get this thing going. Now, the last muscle, turn around again, Bob. There you go. The teres minor. There's a teres major, teres minor. We're going at the teres minor, which is even below that, but still in the back. This one, I like this one. It's called the Hornblower's test.
Hornblower.
Yeah, it's like when you were a kid, Bob, maybe you still do it. I haven't done it for a while, but you know, if a semi goes by and you're walking down,
you go like
you
this.
go like
Yeah,
this. Yeah, I think that's where this came from. So
What do you mean if I still do that?
well, we're assuming you still do. Why not? It's kind of
Why
fun.
would I?
Oh.
Oh, good Lord. Okay.
90 degree elbow, 90 degree at the shoulder, so it looks like this. Thumb is like this, kind of like you're hitchhiking, but
Okay, I'm out
there you
here.
go. Like this. Okay.
Should I be like this so they can see it better?
Sure, whatever works, Bob. There you go. Okay. Now I'm going to grab here and I'm going to hold here to stabilize so he doesn't have to hold it. I'm going to stabilize and I'm going to externally rotate this way. Let's go this way just a little bit so they can
Okay.
see that. Now I'm not going to obviously make it
Crank.
hurt, but it's just going to go to end range where you can feel that's as far as it wants to go. Same as the other test. I'm going to let go, Bob. See if you can maintain that position.
Okay.
There.
And I can.
Right. So if I did this and I'd say hold it, and it goes like this, and he has no power to maintain this, that's indicative that muscle is injured. Yep.
Now, if you go like this too, and I get very anxious, it might mean that my shoulder is prone to dislocate.
Right. Yeah. So yeah, these are gentle tests. Yeah. All right. Now the famous subscapularis, the one it's kind of
hidden.
Yeah, it's between the shoulder blade and the rib cage. It's in there. Bob, I can actually get.
Yeah, you can get to me.
Yeah, this is fun. You really can't appreciate this, but see, I'm digging right up in there. Then my fingers are disappearing into under the scapula, and I can feel that subscapularis. All right, that's.
I thought you'd at least buy me dinner first before you do that.
Oh no, that doesn't hurt, does it, Bob?
No.
No. Okay. There's 3 tests for this one actually.
Okay.
Okay. First one is called the belly press.
Okay.
Hands on your belly like this. Take your elbows, and you're going to go out like this.
Yep.
Now you're going to press into your stomach. Because what this muscle is responsible for doing is internal rotating the humerus. Now, if
this is one you do yourself.
yeah, this is one.
Okay, cool.
If what happens a lot of times, if this muscle isn't working, you'll see the arm compensate by going in like this because it's not working.
You can't push down.
Right.
You can't. I mean, you'll be able to tell if you can't push.
Right. Or if I'm my therapist and I'm
You're testing.
well, you push onto my hands, and then I'm just going to feel for one how hard they're pushing. But you really don't need to do that. The next one is the bear hug test. So you put your right hand, if this is, there you go right over your shoulder. Okay. The elbow's going to lift off the body. There you go, like that. I'm going to stabilize this here. Now let me get my hand here, pull you away. Now I want you to push your hand towards your shoulder. And I'm just going to resist it and hold it. Or I'm going to go out this way.
If I can't hold it,
right.
It's weak.
This is one where I would definitely do one arm and then do the other arm if there's any question. Which is true with all these.
It's a good test.
Now this one, I don't get this one. This is the Gerber's liftoff test. Or the Gerber's, liftoff test. Gerber's is a baby food thing?
I don't know, must be another Dr. Gerber.
It could be Dr. Gerber.
Yeah.
Why don't you stand up for this one, Bob?
I think I know this one.
The back of the hand, the dorsum of the hand goes to the sacrum.
Yep.
Right. All right. So there's 2 ways to do this. First of all, you have the hand against the back or the sacrum, and I'm going to ask Bob, can you lift your hand away from there? So now he's got 4 inches there. Okay. The other way to do it is start with it about 2 inches away. Okay. And then I'm going to say, hold it right there. Don't let me move it. And I'm going to push in. Up. So if he lets me push in, that means it's a weak muscle or injured. If he can hold it, and I push in this way, and this gap is maintained, then that would mean the muscle's good. And there's going to be some pain associated with this or not.
So easy enough, again, you could do this on yourself.
Right,
You can put this back and see if you can lift it up.
Right, yeah.
If you can't, your subscapularis may be involved. So there's a couple of them that you can do on your own. So
that pretty much covers the whole shoulder complex.
You did a nice job, Brad.
Wow.
I applaud you.
Oh, thanks, Bob. I'm glad someone's applauding me. Just do it a couple more times. I want to get used to this. This might be the last time it ever happens.
All right, thanks for watching.